people who want cradle-to-grave care from the government, and gentlemen. In this series, I intend to examine and undermine the libtard contention that having the government take over X will have positive results. The knee-jerk reaction from neo-Marxists is to have the government take over whatever happens to be in crisis at the time. If there isn't a crisis, they can manufacture one. If there is a crisis and X is already effectively controlled by the government, then just ignore that and pretend the private sector controls it. Libtards shield for Obamacare because they have an agenda where the federal government becomes the be-all, end-all of virtually everything. This will certainly result in limited individual freedom, is contrary to the Constitution in most cases, and will result in the masses being controlled and contained by the government. Leftists wanted Obamacare because they believe healthcare is run by the private sector, which is not true. It's been moving towards socialization for some time. They also want it because they believe the government will do a better job. That is the intent of this series, examining other areas where the federal government has a vast amount of authority and has a vast amount of taxpayer dollars at their disposal with poor results. Let's start with the early childhood development program called Head Start. It's been around for over 40 years. Is it a success? It is my contention that this federal government program is an abject failure. All the links are underneath the video. Check them out at your leisure. My first point focuses on the fact that the government uses someone else's money to implement this program, which results in inefficiency in implementing the program. After all, if all you need is more money from the public treasury, just go get it. To hell with efficiency and honesty. GAO investigators attempted to register children from fictitious families in Head Start programs in 6 states and the District of Columbia. The GAO created 13 fictitious families that earned too much income or possessed other characteristics that would disqualify the children from participating in Head Start. The result is embarrassing. In 8 out of 13 eligibility tests, our families were told they were eligible for the program and instructed to attend class. In all 8 of these cases, Head Start employees actively encouraged our fictitious families to misrepresent their eligibility for the program. In at least 4 cases, documents we later retrieved from these centers show that our applications were doctored to exclude income information for which we provided documentation which would have shown the family to be over income. Employees at 7 centers knowingly disregarded part of our family's income to help make over-income families and their children appear to actually be under income. Nobody from the government would do that. They're honest. This would have had the effect of filling slots reserved for under-income children with over-income children. At 2 centers, staff indicated on application forms that one parent was unemployed, even though we provided documentation of the parent's income. A Head Start employee at one center even assured us that no one would verify that the income information submitted was accurate. Honest government employees, yes. Good work if you can get it. The GAO finding is not surprising given that previous reports show that the Department of Health and Human Services does a poor job administering the program. In 2000, the GAO found that 76% of Head Start grantees reviewed were not in compliance. 76% of Head Start grantees reviewed were not in compliance with financial management standards. In a subsequent review, more than half remained out of compliance. In 2005, the GAO reported that HHS still couldn't adequately identify financial management weaknesses of Head Start grantees. In 2008, the GAO reported that HHS still had not undertaken a comprehensive assessment of Head Start's risks and said that it had made little progress in ensuring that the data it collects from grantees are reliable. Head Start isn't that effective at getting children a Head Start on kindergarten either. In 2010, HHS released a very long anticipated study of Head Start's effectiveness, which is the most rigorous analysis to date. The program is supposed to give disadvantaged children a Head Start in life. However, the study found almost no advantages to children in kindergarten and grade 1 from having gone through Head Start compared to children who had not. Of the 112 measurements in the new HHS study, which covered areas such as academics, socio-emotional development, and health, only a handful showed any statistically significant benefit to participants of Head Start. In addition, most measured benefits disappeared once more rigorous statistical methods were applied. In other words, there was virtually no benefit to children of having attended Head Start. After 45 years and $166 billion in spending, it's approaching $10 billion a year now. It's apparent that this great society relic isn't the best way to help disadvantaged children. Looking at effects on participants does not change the overall patterns found in the main analysis, which showed that Head Start improved children's language and literacy development during the program year, but not later, and had only one strongly confirmed impact on math ability in a negative direction. For the 3-year-old cohort, kindergarten teachers reported poorer math skills for children in the Head Start group than children in the control group. Great counterproductive taxpayer money. Imagine that. It should also be pointed out that the government took about 6 years to release this data. What's the holdup? Lastly, we have the Department of Health and Human Services Child Care and Development Fund, which is just another facet of the cradle-to-grave mentality of our government and the neo-Marxist faction of the Democrat Party. A new report from the GAO shows widespread fraud by CCDF recipients in the sampling of states that it investigated. Our proactive testing revealed that CCDF programs in the 5 states we tested were vulnerable to fraud because states did not adequately verify the information of children, parents, and providers, and lacked adequate controls to prevent fraudulent billing. In 7 of 10 cases, in 4 states, our fictitious parents and children were admitted into the CCDF program because states did not verify the personal and employment information provided by applicants. 3 of those states paid $11,702 in child care subsidies to our fraudulent providers, and only 2 states allowed the providers to overbill for services beyond their approved limit. Only 1 state successfully prevented our fictitious applicants from being admitted into the program, but officials from that state told us they perform only limited background checks on providers and cannot immediately detect overbilling. The GAO's findings can be summarized as follows. States lack effective controls to verify parent and child information, such as parents' income eligibility. States do a poor job of checking the backgrounds of providers, probably because they'll just get taxpayer dollars to replace the wasted money, which means subsidized child care could be being provided by sex offenders. States have weak controls to prevent fraudulent billing. Nonetheless, the GAO found numerous instances of delays in processing applications. There you have it, folks. A program costing over $9 billion a year that has been around for more than 4 decades is having no discernible effects on early childhood learning, yet the money keeps pouring in because it comes from taxpayers. In addition, government workers in charge of Head Start have been found to be more than willing to falsify information just to get people in the program, because more people in the program means more tax dollars flowing in, more government workers, and more power. Follow the money, people. It reminds me of efforts at the state level to sign up people for more welfare programs, actively recruiting people. Are you breathing? You may qualify for government program X financed by your neighbor. The Child Care and Development Fund is also a prime target for fraud, as little to no effort goes into checking whether these people actually qualify or if overbilling has been done. It's not that big a deal to the government. They're doing it with your money, and there's plenty to go around. If this were the private sector, measures would be taken to cut down on fraud and overbilling because it would be their money on the line. Head Start is a gigantic failure, and you want that government to run your health care? I think not. And I know I'll be accused of, oh, you hate education. You don't want kids to be educated. You must hate all kids. You want them all to be dumb. No. I want the federal government to do what it's supposed to do via the enumerated powers in our Constitution, and education is not one of those. And even if it were, an intelligent person would pull the plug on Head Start and get the government out of it. And of course, these programs obviously are rife with fraud and inefficiency, which is a hallmark of most government programs. I just want an effective education program, not, obviously Head Start is not the answer. Obviously the federal government involved in it is not the answer, even if it were constitutional. So there you go, folks. That's just part one. Head Start is a gigantic failure. It's run by the government, controlled by the government, financed with your money, and you want that government to run your health care. I don't think so. Have a nice day.